Jaundice is a medical condition that causes the skin, whites of the eyes, and mucous membranes to turn yellow due to a buildup of bilirubin in the body. Bilirubin is a yellowish pigment that is produced when red blood cells break down. Normally, bilirubin is processed by the liver and excreted in bile, which is then eliminated from the body through the feces. However, if the liver is not functioning properly, bilirubin can build up in the bloodstream and cause jaundice. Prehepatic jaundice is a type of jaundice that occurs when there is an excessive breakdown of red blood cells, leading to an increased production of bilirubin. Bilirubin is a yellowish pigment that is produced when hemoglobin, the protein that carries oxygen in red blood cells, is broken down. Normally, the liver processes bilirubin and excretes it in bile, which is then eliminated from the body through the feces. However, in cases of prehepatic jaundice, the liver is functioning normally but is overwhelmed by the large amount of bilirubin produced from the breakdown of red blood cells. This leads to an accumulation of bilirubin in the bloodstream, which can cause yellowing of the skin, eyes, and mucous membranes. Prehepatic jaundice can be caused by a variety of conditions that increase the breakdown of red blood cells, such as sickle cell anemia, thalassemia, and malaria. Treatment for prehepatic jaundice typically involves addressing the underlying condition causing the excessive breakdown of red blood cells, and may include medications or blood transfusions. Hepatocellular refers to something related to the hepatocytes, which are the main functional cells of the liver. The term hepatocellular is often used to describe medical conditions that affect the liver cells, including hepatocellular carcinoma, a type of liver cancer that starts in the hepatocytes. Hepatocellular carcinoma, HCC, is a type of liver cancer that typically arises from liver cells that have been damaged or have undergone mutations. The disease is often associated with chronic liver diseases such as hepatitis B or C, alcohol-related liver disease, or non-alcoholic fatty liver disease. HCC is one of the most common types of liver cancer and can be difficult to treat if not detected early. Other conditions that can affect hepatocytes include hepatitis, which is an inflammation of the liver caused by a viral infection or other factors, liver cirrhosis, which is a chronic and progressive disease that results in the scarring of the liver tissue and impairs its function, and liver failure, which occurs when the liver is unable to perform its vital functions adequately. Posthepatic jaundice, also known as obstructive jaundice, is a type of jaundice that occurs when there is a blockage in the bile ducts, preventing bilirubin from being excreted from the body. Bilirubin is a yellowish pigment that is produced when red blood cells are broken down. Normally, bilirubin is processed by the liver and excreted in bile, which flows from the liver to the gallbladder and then into the small intestine. However, if the bile ducts become blocked, bile cannot flow out of the liver and accumulates in the bloodstream, leading to jaundice. Posthepatic jaundice can be caused by a variety of conditions that block the bile ducts, including gallstones, tumors, or inflammation of the bile ducts. Symptoms of posthepatic jaundice may include yellowing of the skin and eyes, dark urine, pale stools, itching, and abdominal pain. The main symptom of jaundice is yellowing of the skin, eyes, and mucous membranes. This occurs because of the buildup of bilirubin, a yellowish pigment that is produced when red blood cells are broken down in the bloodstream. Other symptoms of jaundice may include dark urine. Bilirubin is excreted in urine, and when levels are high, urine may appear dark or brown. Pale stools. Bilirubin gives feces its characteristic brown color, so when levels are high, stools may appear pale or gray. Itching. The buildup of bilirubin in the skin can cause itching. Abdominal pain. Jaundice caused by gallstones or other types of blockages in the bile ducts may cause abdominal pain. Fatigue. Jaundice can cause fatigue and weakness. Loss of appetite. Jaundice can cause a loss of appetite and unintended weight loss. Nausea and vomiting. Jaundice caused by liver disease or infection may cause nausea and vomiting. The treatment for jaundice depends on the underlying cause. In some cases, jaundice may go away on its own as the underlying condition is treated, while in other cases, more specific treatments may be necessary. Some common treatments for jaundice include managing the underlying condition. If jaundice is caused by an underlying medical condition such as hepatitis, anemia, or gallstones, treating that condition may help to alleviate the jaundice. Phototherapy. In newborns with jaundice, phototherapy may be used to break down bilirubin in the bloodstream. Blood transfusions. In some cases of severe jaundice, a blood transfusion may be necessary to replace damaged or diseased blood cells. Medications. Certain medications may be used to reduce bilirubin levels in the bloodstream or to manage symptoms of jaundice. Surgery. In cases of blockage in the bile ducts, surgery may be necessary to remove the obstruction. Liver transplant. In cases of severe liver damage or failure, a liver transplant may be necessary to replace the damaged liver with a healthy one.